Dear friends, welcome back to the Senior Healthcare channel, where we explore useful, safe, and easy to apply knowledge to maintain quality of life as we age. Every stage of life comes with its own challenges. In middle age and the senior years, male vitality and urinary health become important factors that are often overlooked. Especially, there are certain habits that seem harmless but may pose hidden risks to the sensitive area of men. According to materials from the Journal of Urology and reports from the American Urological Association, more than 50% of men over the age of 60 experience issues related to hormone function. The prostate and the urinary system, the good news is, with proper understanding and suitable adjustments, we can maintain vitality and prevent unwanted complications. Before we begin, if you have not subscribed to the channel, I encourage you to click the subscribe button and turn on the notification bell so you do not miss any useful health tips. If you find today's topic helpful, please type the number 1 in the comments. If you are not satisfied, please type 0 so I can continue to improve the content to better serve you. E. Do not underestimate your vitality health. In middle age and the senior years, male vitality health is not only a private matter but also a reflection of overall physical condition. Many men often believe that a decline in vitality with age is normal and not something to worry about. However, in reality, these changes can serve as a warning sign about circulatory health, hormone balance, and even cardiovascular function. According to research published in the Journal of Urology, when men begin to experience difficulties in maintaining male vitality, within the following 7 years, up to 14% will face serious cardiovascular events. This shows a close relationship between blood circulation, the activity of aging hormones, the stability of the nervous system, and overall mental well-being. When male hormones, especially testosterone, start to decline after the age of 40, the body's energy production, blood sugar control, prostate health, and urinary system function are also affected. In addition, prolonged psychological stress contributes to unpredictable disorders in male vitality function. Therefore, do not ignore the early signs. Observing, listening to your body, and having regular checkups help detect potential abnormalities early. A healthy lifestyle, weight control, stable aging hormone level, and good stress management will help men maintain long-term stability for their male vitality health. Do not follow unverified folk remedies. As age increases, many men, concerned about their vitality health, turn to methods shared on the internet or in the community, hoping to quickly improve their strength. However, most of these methods have never been verified by reputable medical organizations and carry many potential health risks. Many advertisements promise to increase the size of the sensitive area using topical solutions, herbal soaks, or even manual stretching exercises. Some methods, such as manually stretching by hand, also known as lengthening exercises, can actually cause micro damage inside the connective tissues. This weakens the structure of the organ and gradually leads to irreversible decline in male vitality function. Some people have even tried homemade devices, such as plastic rings made from soft drink bottles or hard objects found at home, to create blood flow pressure, hoping to enhance function. However, these items are not medically safe. They may cause swelling, blood flow blockage, tissue necrosis, and even require emergency surgical intervention. There have been many cases in major hospitals in the United States where rescue teams had to remove dangerous foreign objects from the sensitive area. According to the American Urological Association, AUA, up to now, there is no folk remedy or homemade method that has been proven to significantly improve male vitality function without causing side effects. The use of medications or supportive devices should be prescribed and closely monitored by a specialized physician. SAN. Do not forget proper hygiene. Proper hygiene is a fundamental part of protecting the sensitive area, especially as age increases. However, many men mistakenly believe that the more thoroughly they clean, the better it is. In fact, improper hygiene can sometimes cause irritation and damage to this delicate skin. For men who have not undergone circumcision, gentle cleaning underneath the foreskin is extremely important. If the foreskin is not gently pulled back for cleaning, sebum, sweat, dead skin cells, and bacteria will accumulate to form smegma. This buildup can lead to inflammation of the foreskin, causing itching, burning, swelling, and even spreading infection throughout the urinary system. However, it is not recommended to use strongly scented soaps, harsh cleansers, or scrub too hard during cleaning. The skin in this area is very thin, easily scratched and damaged, which increases the risk of infection and can even cause ulcers that are slow to heal. Simply using warm, clean water combined with a small amount of mild, unscented body wash and gently patting dry is sufficient. If a man finds it difficult to pull back the foreskin, this may be a sign of phimosis, a condition that should be examined by a urology specialist. Some cases can be treated with topical ointments to help stretch the skin, or may require a simple surgical procedure to improve function and make hygiene easier in the future. So, do not ignore unusual signs. In middle age and the senior years, every unusual change in the body should be paid attention to, especially signs related to male vitality, health, and the urinary system. Sometimes very small initial signs are early warnings of more serious problems if not addressed in time. When there are symptoms such as pain during urination, burning sensation, sores or rashes in the sensitive area, or blood in the urine, men should not be subjective but should visit a urology specialist immediately. These symptoms may be related to conditions such as urinary tract infections, bladder stones, cystitis, or in some rare cases, early signs of cancer in the intimate area or bladder cancer. According to data from the American Urological Association, penile cancer is a rare but very aggressive condition. If detected early, the chance of preserving tissue is very high. However, many men feel embarrassed and silently endure because they are hesitant to visit a doctor, leading to late detection and more serious consequences. It is important to remember that specialists have the knowledge and experience to approach the issue professionally with understanding and without judgment. Early examination helps early detection, early treatment, and minimizes major interventions. Later, delaying only increases the risk and makes the treatment process more complicated. Woo! Do not be careless about safety during intimacy. In middle age and the senior years, maintaining intimate closeness is natural and necessary. It helps nurture emotional connection, supports male vitality health, and balances hormones. However, gun safety should always be a top priority to prevent unwanted accidents during this process. One of the risks that many men often do not anticipate is injury to the private area due to strong impact during intimacy. When the erect tissue is bent, struck, or subjected to sudden force, it may lead to a condition called corporal tissue injury, which can be simply understood as a penile fracture. This is a medical emergency that requires immediate surgical intervention to avoid long-term damage to male vitality function. In addition, using proper protective products such as high-quality condoms helps prevent infection risks while also supporting confidence and comfort during intimacy. Men should try different types of condoms to find the most suitable one for their body, avoiding irritation and creating a natural feeling during use. Control also plays a very important role, adjusting the pace, angles, and gentle coordination between both partners will help reduce the risk of strong impacts that may cause injury. In addition, using safe lubricants also helps reduce friction, avoid irritation, and protect the thin and sensitive skin in this area. Luke, do not expose the private area to high temperatures too often. Temperature may seem like a small factor, but it greatly affects male vitality health, especially testicular function and hormone balance. The male body is designed to keep the testicles outside the abdominal cavity to maintain a cooler temperature compared to the body's core temperature. This cooler environment helps ensure sperm production and stabilize aging hormones. When frequently exposed to high temperatures, such as sitting for long periods on hot surfaces, using hot tubs, steam rooms, placing laptops directly on the thighs, or keeping mobile phones in front pockets, men unknowingly create an unfavorable heat environment for the testicles. According to research from the NIH, National Institute on Aging, prolonged high temperatures can reduce sperm quality, affect hormone function, and even contribute to a decline in vitality over time. Sitting for long periods in car seats during summer, using heated massage chairs, or the habit of using electric blankets are also factors that raise the temperature in the private area, which many people do not notice. To protect long-term vitality function, men should minimize prolonged exposure to high temperatures. When working with a laptop, place it on a desk instead of on the thighs. Mobile phones should be kept in shirt pockets or back pockets to avoid direct heat exposure. T. Do not use excessive force during self-stimulation. Self-stimulation is a normal physiological need and still holds certain benefits for male vitality health in middle age and the senior years. However, the way it is performed is what matters. Many men have the habit of using excessive force or too rapid rhythm during self-stimulation, which over time may lead to unwanted consequences. Using too much squeezing force causes the body to gradually adapt to a level of strong stimulation that exceeds natural physiological limits. Over time, the nervous system and sensory receptors in the sensitive area become desensitized, making it difficult to achieve satisfaction during real intimacy. Experts refer to this as strong force habituation syndrome, which gradually reduces sensitivity and hinders harmonious coordination with a partner. In addition, continuous strong friction may cause redness, scratches on the thin skin, and even micro-injuries that are slow to heal. Some men experience prolonged soreness in the private area after excessive self-stimulation. A safer approach is to use suitable lubricants to reduce friction, apply moderate pressure, and create a gentle sensation similar to natural stimulation during intimacy. This activity should be carried out in a comfortable space, without haste or feelings of secrecy, so that the body can receive sensations in the most natural way. Do not smoke and maintain an unhealthy lifestyle. Male vitality health is not only influenced by hormones or age, but is also closely related to daily lifestyle habits. Among the negative factors, smoking is considered a leading cause that weakens urinary and male vitality function over time. When smoking, harmful substances in the smoke cause direct damage to the blood vessel walls, reducing the elasticity of the small blood vessels, including those that supply blood to the erectile tissue. The decrease in blood flow leads to reduced vitality and a lower ability to maintain stable male vitality function. In addition, smoking increases the risk of bladder cancer, prostate cancer, and other serious diseases of the urinary system. Not only smoking, but also the overuse of alcohol. An unbalanced diet and lack of physical activity reduce the natural production of male hormones. According to research published by the NIH, National Institute on Aging, men who maintain an active lifestyle and exercise regularly have more stable testosterone levels and a significantly lower rate of male vitality disorders compared to those with a sedentary lifestyle. Changing lifestyle habits does not need to be sudden. Simply starting with small steps such as walking 20 to 30 minutes a day, increasing vegetable intake, limiting sugar and animal fat, getting enough sleep, and managing stress can create sustainable improvements in aging, hormone health, and long-term male vitality function. Joe, do not blame yourself too much when problems occur. One of the private issues that many middle-aged and senior men often face is the feeling of self-blame when male vitality health shows signs of fluctuation. The decline is sometimes only temporary due to various factors such as stress, fatigue, hormonal changes, or side effects of medications for chronic diseases. However, many people see it as a failure and gradually fall into a negative emotional cycle. This repeated anxiety increases mental stress, activates the sympathetic nervous system, and restricts blood flow to the erectile tissue. As a result, male vitality disorders become more difficult to control, creating a prolonged stress loop. According to analysis by Dr. John E. Morley, a senior hormone expert in the United States, psychological factors play an equally important role as physical factors in maintaining stable vitality function in older adults. What men need to remember is that anyone can go through unfavorable moments. Experiencing it occasionally does not mean that male vitality function has permanently declined. Instead, approach it gently. Only share feelings with your partner or a healthcare professional if necessary. Understanding and support from a partner, along with small adjustments in daily habits, can bring significant improvements. Most importantly, allow yourself to relax and avoid putting heavy pressure on yourself, because mental stability is one of the healthiest ways to support aging hormones. Sure, do not completely abandon your intimacy life. When entering middle age and the senior years, many men gradually become hesitant, shy, or voluntarily distance themselves from male vitality activities, believing that it is a natural rule of aging. However, in reality, maintaining regular male vitality activity appropriate to physical condition plays an important role in overall health. According to studies published by the Journal of Urology, when male vitality activity remains stable, blood continues to circulate well to the erectile tissue, helping maintain elasticity and limiting the formation of fibrous plaques or mild tissue contraction over time. At the same time, natural nocturnal erections, which still occur regularly 3 to 5 times each night in healthy men, also serve as a self-protective mechanism that maintains the normal structure of the sensitive tissue. Completely stopping male vitality activity for a long period may cause the body to gradually reduce its natural reflexes, leading to a gradual decline in aging hormones, causing both desire and sensation to decrease. For men who still have the desire and suitable health conditions, maintaining intimacy with a partner at an appropriate, gentle, and joyful level without pressure or performance concerns is recommended. In addition, if you notice a prolonged deep decline in desire or difficulty resuming activity, you should proactively consult with a urology or hormone specialist to receive safe and personalized solutions appropriate for your physical condition. We have just gone through 10 important things that every middle-aged and senior man should pay attention to in order to sustainably protect male vitality health in the urinary system. At every stage of life, Proper care for the sensitive area not only helps maintain quality of life, but also serves as a mirror reflecting the overall health condition of the body. As you have seen, small mistakes in daily habits, such as overly vigorous hygiene, applying unverified remedies, prolonged exposure to high temperatures, or maintaining an unhealthy lifestyle, can gradually weaken vitality function, sometimes without immediate awareness. In addition, psychological factors also play a very important role. Blaming oneself, excessive anxiety, or hiding abnormalities only prolongs the stress cycle and makes everything more complicated. However, the good news is that most male vitality issues can be prevented or significantly improved if you take proper care of yourself. A balanced diet, regular exercise, weight control, avoiding smoking, managing stress, and working with specialists when necessary are the keys to maintaining stable aging hormone health over the long term. If you notice any abnormal signs, do not hesitate to seek medical consultation for specific advice. Early detection and intervention always bring positive results and minimize later complications. If you find today's sharing helpful, please click the subscribe button and turn on the notification bell so you do not miss upcoming content. In the next video, we will share simple exercises to help strengthen the pelvic area, support control of urinary leakage, and enhance quality of life in the senior years.